Welcome to the Deep Dive. Today we're taking a close look at reproductive anatomy and physiology. It's really crucial stuff for any nursing student.
Absolutely. And it's not just about the textbooks. I mean, understanding reproductive systems is really vital for nursing care. Think about assessments, think about client education, family planning.
So many different areas, yeah.
Tons.
Okay, so let's get started. We're going to cover both male and female systems today. So where should we begin?
Let's start with the female system. And, the external anatomy is a great place to start. The vulva, right? That's the gateway, so to speak.
Yeah.
That includes the labia majora, labia minora, clitoris, and the perineum.
Okay, the labia, I know those are the folds of skin.
Right, exactly. They're like the protectors. They shield those more sensitive internal structures. So the labia majora, those are the outer folds. They've got the pubic hair, and they provide some cushioning. And then the labia minora, those inner folds, are hairless and more delicate. Those surround the vaginal opening.
Okay, that makes sense. What about the clitoris? I know that that's involved in sexual pleasure. Can you explain a little more about that?
Of course. A lot of people are curious about the clitoris. It's actually mostly internal, and it's made up of erectile tissue, just like the penis. It's super sensitive, packed with more nerve endings than any other part of the body. When it's stimulated, it fills with blood, and, that leads to arousal and pleasure.
Wow. That's really interesting. I had no idea it was so complex. As nurses, why is it important to, really get into the nitty-gritty details of the anatomy?
Well, think about it. If a patient's having pain, discomfort in the vulvar area, wouldn't it be helpful to really understand all the structures involved? Or if you're teaching a patient about, say, safe sex practices, you really need to be able to describe the anatomy accurately.
Right. That makes a lot of sense. Okay, so we've explored the outside. Let's go inside. What are the key parts of the internal anatomy?
All right, so we've got the vagina, the uterus, the fallopian tubes, and then the ovaries. Each one of those is really critical for reproduction. Everything from receiving the sperm to actually nurturing a fetus.
Yeah, okay. Let's start with the vagina. I know it's the birth canal, but is there anything else we should know about it?
Yeah, so the vagina is a muscular canal. It connects the external genitalia to the cervix, which is the opening of the uterus. It's super elastic, right? It expands during intercourse and childbirth. And here's something you might not know. It's actually got an acidic environment, which helps protect it from harmful bacteria.
Oh, yeah. That's why douching's a no-no, right? It disrupts that.
That's exactly right. The vagina is self-cleaning, and douching can actually make you more prone to infections. So as nurses, we really need to make sure we're teaching patients about that, promote healthy practices.
Yeah, definitely. Okay, so what about the uterus? I know that's where the fertilized egg implants. What happens if it's not fertilized, though?
Well, that's where the menstrual cycle comes in. The uterus has a lining called the endometrium. And that lining, it gets thicker throughout the cycle, just preparing for a potential pregnancy. If fertilization doesn't happen, that lining sheds, and that's what causes menstruation.
Okay, that makes sense. So the fallopian tubes and ovaries, what's their role in all of this?
Okay, so the fallopian tubes, they're like these slender pathways connecting the ovaries to the uterus. It's usually where fertilization takes place. Think of them as like the meeting point for the sperm and the egg.
Okay. And the ovaries, those produce hormones, right?
They do. The ovaries are like the control center,
Okay.
They make the eggs and hormones like estrogen and progesterone. Those are crucial for regulating that menstrual cycle and, supporting a pregnancy. And here's something that's kind of wild. A woman is actually born with all the eggs she'll ever have.
Seriously?
Yep. They're all stored in the ovaries, and they get released one at a time during ovulation.
Wow. Okay, so to recap, the ovaries release the eggs, the fallopian tubes are where fertilization happens, the uterus is preparing for potential pregnancy, and the vagina is the pathway for everything. It's all starting to make sense.
Right. It's amazing. And when we get into the menstrual cycle, you'll see just how connected it all is.
Okay, so let's talk about that now. How does the menstrual cycle actually work?
Well, it's like a perfectly timed dance of hormones. The hypothalamus, the pituitary gland, and the ovaries are all in on it. It starts with the hypothalamus, which is in the brain, releasing this hormone called GnRH, and that tells the pituitary gland, also in the brain, to release follicle-stimulating hormone, or FSH.
So the brain's really running the show here. What does FSH do?
FSH helps a follicle grow in the ovary, and that follicle houses the egg. As the follicle grows, it releases estrogen, and estrogen, that's what makes the lining of the uterus thicken up. It's getting the uterus ready.
Got it. Estrogen is rising, the lining's thickening, then what?
Okay, around day 14, give or take, there's a surge of luteinizing hormone, or LH, from the pituitary gland. That LH surge, it triggers ovulation, the egg is released from the follicle.
Wow. Okay, so the egg is released. What happens then?
Okay, so after that, the ruptured follicle becomes something called the corpus luteum. And the corpus luteum, its main job is to make progesterone. Progesterone really preps the uterine lining for implantation, making it like the perfect spot for a potential embryo.
So progesterone keeps the pregnancy going if the egg is fertilized.
Exactly. But if it's not fertilized, the corpus luteum breaks down, and then estrogen and progesterone levels drop.
So that drop is what triggers menstruation.
Yep. The body's like hitting the reset button, getting ready for the next cycle.
It's wild, like an orchestra of hormones working together.
It really is. And understanding those hormonal shifts can help you understand, what your patients might be feeling throughout their cycle.
So just to clarify, the main phases are follicular, that's where the follicle grows and estrogen's rising, then ovulation, when the egg is released, and then luteal, where that corpus luteum forms and progesterone's the dominant hormone.
You got it. And remember, estrogen and progesterone, they're the real stars of the show.
Okay, that makes so much more sense now. I've heard that there are like physical signs of ovulation, things nurses should look out for. What are some of those?
Good question. One that's pretty noticeable is a change in the cervical mucus. Around ovulation, it becomes thinner, clearer, and stretchy, almost like egg whites. That makes it easier for the sperm to travel.
Right, right. So women who are trying to get pregnant might notice that change.
Exactly. It can be a good sign.
Are there any other signs? Anything women might feel during ovulation?
Well, some women have a slight temperature increase, and sometimes they'll feel some mild cramping. We can definitely teach patients about these signs and help them, track their cycles if they're trying to conceive.
Okay, so we've covered the basics of the cycle, the hormones, and ovulation. Now, what about perimenopause and menopause? I know these are things all women go through, but I'm not totally clear on, what actually happens.
Sure. So perimenopause is like the transition leading up to menopause. It usually starts in a woman's 40s, but it can be earlier or later. Basically, hormone levels start to change, and that causes a bunch of different symptoms.
Like what kinds of symptoms?
Well, it's different for everyone. Some women get hot flashes, irregular periods, trouble sleeping, mood swings.
Okay, and menopause is when the periods stop completely.
Right. Usually we say it's menopause when you haven't had a period for 12 months straight. That usually happens between 45 and 55.
What's going on with the hormones during menopause?
The ovaries are basically slowing down their production of estrogen and progesterone, so that can lead to a lot of changes, vaginal dryness, those hot flashes, night sweats, even bone loss.
So nurses need to be ready to, help women through these changes.
Oh, absolutely. It's important to really understand what's going on, both physically and emotionally, so we can give the best care. We can teach women about these changes, offer support, connect them with resources, and talk about different options for managing symptoms. Remember that 49-year-old woman with the irregular periods we talked about? It's very possible she's starting perimenopause. Understanding the hormones can really help us guide her to the right care.
Wow. Okay, I'm really seeing how this all connects to real nursing situations now.
Definitely.
It's so much more than just, memorizing terms.
Exactly. So are you ready to move on to the male reproductive system?
Let's do it.
Okay, so now let's dive into the male reproductive system. Let's start with the external anatomy.
I'm ready. So we've got the penis and the scrotum, right? The most obvious parts.
Yeah, exactly. The penis, of course, that's the organ for intercourse. It's mainly made up of erectile tissue, and that tissue fills with blood during arousal. That's what causes an erection.
Okay, and the scrotum, that's the pouch of skin below the penis. I know it keeps the testes at the right temperature.
Right. Sperm need to be a little cooler than the rest of the body. The scrotum's like a built-in climate control, It adjusts to keep the testes at just the right temperature.
That's pretty cool. So let's go inside now. What about the internal anatomy? What are the key players?
Okay, so inside we have the testes. That's where sperm are made. Then there's the epididymis, where they mature and hang out until they're needed. And then the vas deferens, that's the transport system, taking sperm from the epididymis to the urethra. And of course, the urethra carries both urine and semen out of the body.
Okay, let's break that down a bit. So the testes, those are the oval-shaped glands. Those are what make the sperm.
Right, and they also produce testosterone. That's the main male sex hormone. Testosterone is important for, a lot of things, like male sexual development, sperm production, even muscle mass and bone density.
Wow, so it really does a lot.
Yeah.
Okay, what about the epididymis? What's its role?
Think of it like a finishing school for the sperm. It's this long, coiled cube attached to each testis. Sperm go there to mature. They actually learn how to swim there.
Okay, and then the vas deferens, that's like the highway that takes the sperm from the epididymis to the urethra.
You got it. During ejaculation, the muscles contract and push those sperm through the vas deferens, and then it joins with the seminal vesicle to form the ejaculatory duct, and that empties into the urethra.
The urethra, so that's a shared pathway for both urine and semen? How does that work? Doesn't get mixed up?
Well, luckily, we have sphincter muscles that control the flow of both, so they make sure that urine and semen don't mix.
Oh, good. That's good design. Okay, so just to recap, we've got sperm being made in the testes, maturing in the epididymis, traveling through the vas deferens, and then they meet up with fluids from the seminal vesicles and the prostate gland, and also the bulbourethral glands, right?
Yeah.
And that all forms semen.
Yes, exactly. Those accessory glands are important because they give the sperm nutrients and lubrication. It helps them survive the journey through the female reproductive tract.
Right, so it's not just about the sperm themselves, it's about giving them the right environment. That makes sense. Okay, let's talk about the male sexual response. Is it similar to the female sexual response?
Yeah, it follows a pretty similar pattern. There are 4 phases: excitement, plateau, orgasm, and resolution.
Okay, let's break those down. So what happens during excitement?
During excitement, blood flow to the penis increases. That causes the erection. And that's usually triggered by, sensory stimulation like touch or visual cues.
Right, and then the plateau phase, is that like the build up to orgasm?
Exactly. The arousal keeps getting stronger and semen starts to collect in the urethra. The heart rate and breathing speed up too.
And then orgasm is the release of that tension, right? And that's when ejaculation happens.
That's it. It's a very powerful, pleasurable experience. There are rhythmic muscle contractions in the pelvic area.
And lastly, we have resolution. So that's the return to a non-aroused state.
Right. The blood flow to the penis decreases, the erection subsides, the body, slowly goes back to its resting state.
Okay, makes sense. Now, I'm curious, are there any, common misconceptions or myths about male reproductive health that you've come across?
Oh, there are tons. A really common one is that a man's virility is all about the size of his penis. But that's just not true. Penis size varies a lot, and it doesn't really affect sexual function or pleasure at all.
I bet that one causes a lot of anxiety. What are some other misconceptions?
Another one is that frequent ejaculation lowers a man's sperm count, but that's not true either. The sperm count might fluctuate a bit, but frequent ejaculation doesn't cause infertility.
It's amazing how much misinformation there is out there. It really highlights, how important it is for nurses to provide good, accurate information to their patients.
Absolutely. We have to address these myths and make sure our patients have the facts so they can make good decisions about their health.
Okay, so we've talked a lot about the biological side of things, but what about the psychological and emotional side? How can we as nurses support those needs in our male patients?
That's such an important point. Reproductive health isn't just physical, right? It's also about emotional and mental well-being. Things like erectile dysfunction, infertility, or even just societal pressures, those can really affect men's mental health.
Yeah, for sure. So how can we approach these conversations with sensitivity? How can we create a space where men feel safe to open up?
Well, active listening is key, right? Let your patients know you're really listening without judgment and that their concerns are valid. Just encourage open communication, ask good questions that let them share their experiences.
And validate their feelings too, right? Let them know it's okay to feel a range of emotions, whether it's frustration, sadness, or even anger.
Exactly. And sometimes just being there, present and supportive, can make a huge difference.
Now, let's talk about contraception. I know there are different methods for both men and women. What are some important things nurses should know when counseling patients about contraception?
Contraception counseling is so important, and nurses are key in this. We need to teach patients about their options and help them find the method that best fits their needs and their lifestyle.
Okay, so what are some of the key things to cover in these conversations?
Well, first, we need to talk about all the different types of contraception that are out there. Barrier methods like condoms, hormonal methods like the pill or the patch, and then the long-acting reversible contraceptives like IUDs.
So we need to know the pros and cons of each method.
Definitely. Each one works a little differently and has different effectiveness rates and side effects. We need to be able to explain all of that and answer any questions they might have.
And it's important to emphasize that, contraception is a shared responsibility, right? Both partners need to be part of the decision.
Exactly. It's a conversation that should happen openly and honestly between both partners. And as nurses, we can help facilitate that. We can offer guidance that's neutral and informative.
Okay, so we've talked about contraception to prevent pregnancy. What about sexually transmitted infections, STIs? That's another really important part of reproductive health, right?
It is. STIs are really common, and a lot of people who have them, they don't even know it. That's why regular screenings are so important.
And as nurses, we need to be able to talk about STIs with our patients, even though it can feel, a little awkward.
Absolutely. It's all about approaching these conversations with sensitivity, being non-judgmental. We have to create that space where patients feel safe, asking questions and sharing their concerns.
What are some key points to highlight in these conversations?
Well, definitely stress the importance of safe sex practices, things like using condoms consistently and correctly.
And getting tested regularly, even if there aren't any symptoms.
Right. A lot of STIs don't have any noticeable signs, so you can't tell just by looking. The only way to know for sure is to get tested.
Yeah, and we need to bust that myth that you can tell if someone has an STI just by looking at them.
Exactly. The only way to know is to get tested.
Okay, great information. Now, going back to men's health specifically, are there any particular conditions that can affect the male reproductive system that we should be aware of?
One common one is prostate enlargement. That's also called benign prostatic hyperplasia, or BPH. As men get older, the prostate gland can get bigger and press on the urethra, which can cause problems with urination.
Okay, so what are some symptoms of BPH?
Well, they might have difficulty starting or stopping urination, a weak stream, frequent urination, especially at night, and they might feel like they can't fully empty their bladder.
Are there treatments for BPH?
There are medications that can relax the muscles in the prostate and bladder, and that can make it easier to urinate. Sometimes, if it's necessary, surgery can be done to remove some of the excess prostate tissue.
So BPH is pretty common, and it can be treated with medication or, in some cases, surgery.
Okay, what about prostate cancer? I know that's a serious concern for men, too.
It is. Prostate cancer is the most common cancer in men. The good news is that it's often slow-growing and very treatable, especially when it's caught early.
Okay, so what are the risk factors for prostate cancer?
The biggest one is age. The risk really goes up after 50. Family history is also a factor, and race plays a role as well. African American men are at higher risk than other racial groups.
So as nurses, we should encourage men to talk to their doctors about prostate cancer screening.
Absolutely. Regular screenings are key. That usually involves a PSA blood test, that's the prostate-specific antigen test, and a digital rectal exam, or DRE. Those can help catch it early when treatment is most effective.
Okay, so we've talked about BPH and prostate cancer. What about erectile dysfunction? I know that can be a sensitive topic for men, but it's something we as nurses need to be prepared to talk about. You're right, it is sensitive. Erectile dysfunction, or ED, is when a man can't achieve or maintain an erection that's firm enough for sex. It's more common in older men, but it can happen at any age.
What causes ED?
It can be a lot of things. Sometimes it's physical factors like heart disease, diabetes, low testosterone. But it can also be psychological, like stress, anxiety, or relationship problems.
So it's not always a simple fix.
It can be complex. Often it needs a multifaceted approach. There are medications that can help increase blood flow to the penis, but it's also important to address any underlying medical or psychological issues that might be contributing.
And we have to be really sensitive and empathetic when talking about this. I mean, for many men, it can be embarrassing or make them feel ashamed.
Absolutely. Open communication, a non-judgmental attitude, and really listening, those are all essential when caring for men with ED. We need to let them know they're not alone and that there are treatments out there that can help.
Okay, so we've covered some of the main conditions that can affect the male reproductive system. But I want to shift gears a bit and talk about something that's often overlooked in men's health: their emotional and psychological well-being.
Right. It's so important to remember that men have feelings too. They experience a range of emotions about their reproductive health, just like women do.
For example, infertility can be just as difficult for men as it is for women.
Exactly. And things like ED or prostate problems, those can really affect a man's self-esteem and body image.
So it's really important to make sure men feel comfortable talking about these issues and to address their emotional needs alongside their physical needs.
Absolutely. Men deserve compassionate, supportive care that recognizes that their reproductive health is about more than just their physical body.
Okay, as we wrap up this section on the male reproductive system, I want to touch on something that's really important in reproductive health care and general cultural sensitivity:
That's a great point. We have to remember that people from different cultures may have different beliefs, values, and even practices when it comes to reproductive health.
Right, like some cultures might have strong taboos about menstruation or sexuality.
Or they might have different views on family planning or contraception.
So, as healthcare providers, it's our job to be culturally sensitive and respect those differences.
We have to approach each patient with an open mind and be willing to learn about their individual needs and beliefs.
And we can't make assumptions or, try to force our own values on our patients.
Right. Culturally sensitive care is about giving individualized, respectful care that meets each patient's unique needs.
Now, before we move on, I want to touch on another important aspect of reproductive health care that's gaining more attention: LGBTQ plus inclusivity.
That's crucial. We need to make sure that the care we provide is inclusive and affirming for everyone, regardless of their sexual orientation or gender identity.
So that means understanding the unique healthcare needs of LGBTQ plus people and being sensitive and respectful when addressing those needs.
Exactly. For instance, transgender individuals might have specific needs related to hormone therapy or gender-affirming surgeries.
And lesbian, gay, and bisexual individuals might face unique challenges when it comes to things like fertility or family planning.
It's so important for nurses to be knowledgeable about these issues and to advocate for care that's inclusive and equitable for all patients.
All right, I think we've covered a lot today. We've gone through the basic anatomy of both the male and female reproductive systems, and we've talked about that complex interplay of hormones that makes it all work.
We've also talked about how important it is to provide care that's sensitive and culturally competent. We have to recognize that reproductive health is really personal and often complex, and it's a big part of a person's overall well-being.
Now, I think it would be really interesting to dive into the specifics of sperm production. How do those cells go from being germ cells to those tiny swimmers?
Absolutely. Let's explore that. It's called spermatogenesis, and it's a pretty remarkable transformation that happens in the testes.
It all starts in the seminiferous tubules, right? Those tightly coiled structures within the testes. That's where the sperm cells are born.
Right. Think of it like a cellular factory. You've got these specialized cells working all the time to make millions of sperm every day.
And it's all driven by hormones, this complex back and forth of signals and feedback loops.
It is. So let's start with the spermatogonia. Those are stem cells that hang out in the seminiferous tubules. Those are the precursors to sperm. They're what sperm cells develop from.
So the spermatogonia are like the starting point for sperm production.
Exactly. And they go through a series of divisions and changes guided by hormones like FSH and testosterone until they eventually become mature sperm.
It's amazing that these tiny cells contain all the genetic information needed to create a whole new person.
I know, right? And that journey from spermatogonia to mature sperm is a pretty incredible feat of cellular engineering.
So how does it happen? What are the main steps in spermatogenesis?
Okay, so first there's mitosis. That's a type of cell division where you get two identical daughter cells. The spermatogonia divide this way, and that makes more spermatogonia.
So that's how they keep the supply of those precursor cells going.
Exactly. And then some of those spermatogonia will change and become primary spermatocytes. These cells are going to become sperm, but they still have a ways to go.
Okay, what happens next?
Well, then the primary spermatocytes go through meiosis. That's a special kind of cell division where the number of chromosomes in each cell gets cut in half.
Why is meiosis so important?
It's crucial for sexual reproduction. It makes sure that when a sperm and egg join, the embryo has the right number of chromosomes.
Right, so it's like making sure the genetic material from both parents is balanced.
Exactly. Meiosis involves 2 rounds of division, and it ends with the formation of haploid spermatids.
Haploid, meaning they have half the number of chromosomes of a normal body cell.
Right. And these spermatids are basically immature sperm. They don't have that tail yet, and they can't move on their own.
Okay, so they're not quite ready for prime time yet.
Right. The last stage of sperm development is called spermiogenesis. That's when those round spermatids go through a major transformation and become those streamlined, swimming sperm we all know.
So it's like a cellular makeover. They're getting ready for their big job.
Yes. They develop a head, a midpiece, and a tail during spermiogenesis.
Okay, let's break that down. What does each part do?
All right, the head of the sperm, that's where the genetic material is. It's all packed in there nice and tight in a streamlined structure.
So it's like a tiny package carrying the blueprint for a new life.
Exactly. And the head also has this special cap called the acrosome.
What's the acrosome for?
Well, think of it as a tiny toolbox, but instead of tools, it's got enzymes. These enzymes are really important. They help break down the outer layers of the egg during fertilization so the sperm can get inside.
So it's like a key to unlock the egg.
Exactly. Okay, now let's move to the mid-piece. That's the area right behind the head. It's packed with mitochondria. Those are the powerhouses of the cell.
Oh, yeah. I remember mitochondria from biology.
Yeah.
They're the energy producers, right?
You got it. And in sperm, the mitochondria provide the energy that fuels those tail movements.
It's like the engine that powers the sperm's journey.
Yes. Okay, and finally, the tail. That's the long, whip-like part that lets the sperm swim. That's called motility.
So obviously the tail is pretty important for the sperm to get where they need to go.
It's absolutely essential. The tail's made up of these tiny protein filaments called microtubules that slide past each other, and that creates that wave-like motion that propels the sperm forward.
It's amazing how these tiny cells can navigate such a complex environment.
It really is. And it's all controlled by a really sophisticated network of signals that make sure the sperm have everything they need for their big journey.
So we've got these fully formed sperm ready to go. What happens next?
Once they're mature, they leave the seminiferous tubules and go to the epididymis to be stored.
Oh, yeah, the epididymis. The sperm's finishing school.
Exactly. It's not just about storage. The sperm go through their final maturation there. That's where they really learn how to swim well.
So it's like a training ground, getting ready for that big race to the egg.
Right. And it's not an easy journey. The female reproductive tract is full of obstacles.
Yeah, it's a real test of their endurance.
For sure. And it's a race against time, too. They only have a limited window to fertilize the egg.
Wow, so we have millions of these sperm, each carrying precious genetic information on this epic journey to try to fertilize the egg. That's pretty incredible.
It really is. Understanding all those details of sperm production and that incredible journey really helps us appreciate how amazing and complex human reproduction is.
Okay, so my sperm knowledge is definitely up to par now.
Yeah.
But I have to ask, what happens when they finally reach the egg? How does fertilization actually work?
I'd be happy to explain. Fertilization, that moment when a sperm and egg unite, it's a pretty awe-inspiring event.
Well, tell me everything. I'm all ears.
So picture this. Millions of sperm are all swimming towards the egg. But it's not just a free-for-all.
Right. There's got to be some kind of system.
Exactly. Fertilization is a very carefully controlled process. It usually happens in the fallopian tube. The egg is just waiting there. And, only one sperm gets to fertilize it.
Wow, what are the chances? How does one sperm actually get inside?
Well, remember that acrosome we talked about, that little toolbox on the head of the sperm?
Right, with all those enzymes.
Yeah. So as the sperm gets close to the egg, it releases those enzymes to break through the egg's outer layers. That's called the acrosome reaction, and it's how the sperm can fuse with the egg's membrane.
Oh, so that's how it gets in. But then how come more sperm don't get in?
Good question. As soon as one sperm gets in, the egg's membrane changes, like instantly. It basically becomes a fortress. No other sperm can get through.
Wow, that's so cool.
It is. That way, only one sperm's genetic material is used to create the embryo. So then, the nuclei of the sperm and egg, they fuse together, combining their genetic material. And that creates a totally unique set of chromosomes. That moment of fusion, that's the very beginning of a new life. A single cell, a zygote, is formed.
It's amazing, isn't it, that this tiny zygote will become a whole person?
It really is. And it all starts with that dance between the sperm and the egg. It's this delicate balance of processes and signals.
We've covered so much, but I have to ask, what about all the new reproductive technology? What's changing the game?
Oh, there are some amazing breakthroughs, especially in assisted reproductive technology, or ARTR. For couples who are having trouble getting pregnant, it's really given them so much hope.
I've heard about IVF, in vitro fertilization. Is that being used more and more?
It is. With IVF, we fertilize the egg with sperm in a lab and then put the embryo back into the uterus. It's gotten more and more successful over time. So many couples have been able to have children thanks to IVF.
It's wonderful. What other technologies are out there?
Oh, there are some really cool new things. Pre-implantation genetic testing that lets us look for genetic disorders in embryos before they're even implanted. So couples can choose to reduce the risk of passing on certain conditions.
Wow, that's amazing. What about egg freezing? A lot more women are doing that, right?
Yeah, it's definitely becoming more common. It's a great option for women who want to have kids later. Maybe they're focusing on their career or they're dealing with medical treatments that might affect their fertility.
It's incredible how science is giving us more options when it comes to reproductive health.
It really is. It's a fast-moving field. The future of reproductive health care is really exciting.
Before we wrap up, I wanted to get your take on something. As nurses, How can we make sure everyone has access to good reproductive health care, no matter who they are or what their situation is?
That's such an important question, and it's a challenge. Access to good reproductive health care is a basic human right, and unfortunately, not everyone has equal access.
Yeah. It's really sad to think that some people can't get the care they need because of things like their income, their race, their sexual orientation.
We need to stand up for our patients and for policies that promote fairness in reproductive health care. We have to tackle those bigger issues like poverty, lack of insurance, and discrimination. And we also need to challenge those outdated beliefs and stereotypes that create stigma around reproductive health.
It's a call to action for all of us, not just in healthcare, but in our communities too.
Right. We need to work together to make sure that everyone has the information, the resources, and the support they need to make their own choices about their reproductive health without feeling ashamed or judged.
Well said. This deep dive has been so insightful, really eye-opening. I think it's clear that reproductive anatomy and physiology is must-know stuff for any nursing student, but it's so much more than that. It's about understanding the complexities of human reproduction, the ethical questions, and how to give compassionate, inclusive care to every patient.
I totally agree. As nurses, we have this incredible opportunity, to guide our patients through these journeys, these really personal journeys, and make sure they feel heard, respected, and confident to make their own choices.
So to all the future nurses out there, learn this stuff well, stay curious, and never stop fighting for your patients. Make sure everyone can get the reproductive health care they need.
And remember, the human body is amazing. Understanding how it works is a lifelong journey. Keep learning, keep exploring, and keep asking questions.
That's it for this episode of The Deep Dive. We'll see you next time. Keep exploring the world of nursing.